It's Dr. Angelina with Georgia SurgiCare, SurgiCare Arts and Aesthetics, and Ideal Body Institute. Today we're going to talk about tummy tuck. And I know we talked about tummy tuck before, but there are quite a variety of procedures that's available and some different techniques. And people always ask about this. And also there's a lot of people who don't know about different techniques of tummy tucks. So tummy tuck, abdominoplasty, right? Abdominoplasty is the procedure that's often included into mommy makeover packages. But basically it's a procedure where we remove excess skin from abdominal wall, from the belly. Usually it is the skin that is below the belly button and often combined with muscle repair, that is diastasis recti. Two six-pack muscles that we have in the belly get separated with age, with pregnancies, with weight gain and loss. We repair those. Sometimes we add liposuction to the procedure, and sometimes also remove excess skin in the middle of the belly, right? So that's already like complex, right? We can make standard tummy tuck where the incision is kind of that smiley face incision that hides easily in your underwear if it's done correctly. The muscle repair, which goes up and down, as I said, between your six-pack muscles, that usually, you don't see from outside, right? You do get a little scar around the belly button because we have to make new home for it. And then there is the fleur-de-lis, which is the tummy tuck where we remove skin with incision like a smiley face, and also incision that goes up and down. That way we can really squish that extra skin and remove that as well. That really helps for people who lost a lot of weight. Okay, so that's the types of tummy tucks to kind of summarize. Now there's also different tummy tucks on how we close them. So standard tummy tuck, you usually have at least two drains to remove excess fluid while your body is healing. Because remember, when we create tummy tuck, we're actually lifting up skin and fat away from the muscle. So now there's like this empty space in between. So when we close that incision, now there's this excess space, right? There's empty space in between two layers, the muscle layer on the bottom and the fat and skin on top. So what would your body do? Our body doesn't like empty spaces. It will try to fill it up with water or fluid. Really, it's not really water, but it's body fluid. And so those drains will have to remove that excess fluid until things can get stuck together and heal together to minimize that swelling. Well, there is a procedure called drainless tummy tuck. And drainless tummy tuck, it's not performed as commonly, but it just depends on the surgeon's and patient's preference. Some doctors like to do that. Some people don't like to do that. Some patients prefer it. Some people just don't know about it, so they never ask about it, so they end up with the standard tummy tuck. But drainless tummy tuck is where we separate the layers. We do everything basically the same way, like the way we normally do, except when we close it, it's not just the incision that gets closed on the bottom. Each layer gets attached back to each other. So we actually have to put stitches, like a little checkerboard of stitches between the two layers to minimize that empty space. So now instead of having one big empty space between the two layers, now we have a whole bunch of little points where we're actually sewing the skin and fat down back to the underlying muscle. And so if little pockets of fluid want to happen, they have nowhere to expand. They'll be just little tiny pockets, and it's easier for your body to absorb this fluid from little pockets rather than from one big pocket. Also, the benefit of that, there is less tension on your incision below. So if you've seen a lot of before and afters, maybe you have friends who had tummy tuck, you'll see that long incision on the bottom, as it's healing, it sometimes tries to separate if it's not sutured correctly because there's a lot of tension on it. Things are trying to pull apart, and so the scar becomes kind of thick. And so when we do drainless tummy tuck and we put all those extra stitches inside, actually will reduce the amount of tension onto this incision, so the scar potentially will be better. Also, you would walk away from the doctor's office or surgery center without the drains. That's why it's called drainless tummy tuck. We don't have to add those tubes that's going to be sticking out of you for the first couple of weeks because the body will absorb its own fluid. So the pain level is probably about the same. The annoyance level is less because I always tell my patients, as the pain level comes down, you start getting annoyed with the drain. Once you're annoyed with the drains, you're doing better because now you're noticing those little things that like hanging around you. So drainless tummy tuck does take a little bit extra time to do. So I always say it's about 2 to 5 hours because it just depends how big the patient is to start with. Are we doing liposuction at the same time or not? Definitely quite a few patients who lost a lot of weight or never had the weight to start with, just had excess skin, who don't need liposuction during tummy tuck. And it's also an option for them. So it doesn't have to be combined with liposuction, but again, a couple hours for people who do not use liposuction, 4 to 5 hours for people who do need liposuction. The drainless part does add a little extra time because now I have to put all those extra stitches underneath the flap to hold it together. So it will add a little bit operating time. So price will vary based on that, new surgeon's experience, and of course the facility. If you have any questions about the different tummy tuck, of course comment on all these posts, Instagram messages, and YouTube videos, or just call our office and set up your consultation. We're still doing and will continue to do our virtual consultation, and of course you can still come to the office if you are in the area. Drainless tummy tuck versus tummy tuck with drains, the classic way of doing stuff. Both good options in my opinion. Some of it is just personal preference. Let me know what you think. Thank you.